एमसीक्यू आज हम लोग क्वेश्चन नंबर 31 करेंगे। तो क्वेश्चन नंबर 31 क्या पूछ रहे हैं? अ 14-year boy presented with repeated epistaxis and a swelling in cheek. Which of these statement may be correct? ठीक है ना। तो 14-year boy with repeated epistaxis, recurrent epistaxis, ठीक है ना, and cheek swelling ठीक है ना। तो करेक्ट स्टेटमेंट, करेक्ट कौन कौन सी बातें हैं इसके बारे में? ऑप्शन 1 डायग्नोसिस नेजोफेरिंजियल एंगियोफाइब्रोमा। ऑप्शन 1 डायग्नोसिस नेजोफेरिंजियल एंगियोफाइब्रोमा। Option 2 contrast CT scan should be done to see the extent. Contrast enhanced CT scan, CT for extent, ठीक है ना। ऑप्शन 3 high propensity to spread by lymphatics, highly spread by lymphatics. Option 4 arise from roof of nose, arise from roof of nose. And option 5 surgery is therapy of choice. सर्जरी इज ट्रीटमेंट ऑफ चॉइस। फिर से देखिए, 14-year boy with recurrent epistaxis and cheek swelling. Correct statement about him. Diagnosis nasopharyngeal angiofibroma. CECT is done for the extent. Highly spread by lymphatics. Arise from roof of the nose. And surgery is treatment of choice. And the right answer is A, B and E. That is diagnosis nasopharyngeal angiofibroma. CECT is done for extent. And surgery is the treatment of choice. ठीक है ना, यही सारे करेक्ट आंसर्स है। ठीक है ना। डायग्नोसिस नेजोफेरिंजियल एंगियोफाइब्रोमा, CECT इज डन फॉर एक्सटेंट एंड सर्जरी इज द ट्रीटमेंट ऑफ चॉइस। क्वेश्चन नंबर 32 देखिए। क्वेश्चन नंबर 32 क्या पूछे? रिगार्डिंग एडिनॉइड, एडिनॉइड्स इनके बारे में क्या बोले? ऑप्शन 1 देयर इज फेलियर टू थ्राइव, देयर इज फेलियर to thrive. Option 2 mouth breathing is seen, mouth breathing is present. Option 3 CT scan should be done to assess size, CT scan for size, CT scan done for size. Option 4 high arched palate is present, high arched palate is present. Option 5 immediate surgery even for minor symptom, immediate surgery even for minor symptoms. फिर देखिए, रिगार्डिंग एडिनॉइड्स there is failure to thrive, mouth breathing is present, CT scan is done for size, high arched palate is present, immediate surgery even for minor symptom. And the right answers are A, B and D. A, B and D. That is, there is failure to thrive, mouth breathing is seen and high arched palate is present. Regarding adenoid, there is failure to thrive, mouth breathing is seen and high arched palate is present. Question number 33 देखेंगे। Question number 33 क्या पूछ रहे हैं? True about septal hematoma is. True about septal hematoma. True about septal hematoma. Option 1 occur due to trauma. It is due to trauma. Option 2 can lead to saddle nose deformity. Lead to saddle nose deformity. Option 3 conservative treatment is done, conservative management ऑप्शन 4 may lead to abscess formation. Lead to abscess formation. फिर से देखेंगे. True about septal hematoma. It is due to trauma, leads to saddle nose deformity, conservative management is done, or leads to abscess formation. And the right answer is A, B and D. A, B and D. That is septal hematoma is due to trauma, leads to saddle nose deformity and lead to abscess formation, but conservative management is not done. Conservative management is not done. Question number 34 देखेंगे. Question number 34. Sensory neural deafness is seen in. Sensory neural deafness is seen in. Sensory neural deafness is seen in. Option 1, Alport syndrome. Option 1, Alport syndrome. Option 2, Pendred syndrome. Option 2, Pendred syndrome. Option 3, Treacher-Collins syndrome. Option 3, Treacher-Collins syndrome. Option 4, Crouzon disease. Option 4, Crouzon disease. Yeah, option 5, Michael's aplasia. Option 5, Michael's aplasia. फिर से देखिए. सेंसरी न्यूरल डिफनेस इज सीन इन Alport syndrome, Pendred syndrome, Treacher-Collins syndrome, Crouzon disease, या Michael's aplasia. And the right answer is A, B, D and E. A, B, D and E. और Treacher-Collins में भी सेंसरी न्यूरल डिफनेस नहीं होती है. Alport syndrome, Pendred syndrome, Crouzon syndrome और Michael's aplasia सब में सेंसरी न्यूरल डिफनेस मिलती है. Treacher-Collins syndrome में सेंसरी न्यूरल डिफनेस नहीं मिलती है, लेकिन Alport syndrome, Pendred syndrome, Crouzon disease और Michael's aplasia सब में तुम्हारी सेंसरी न्यूरल डिफनेस मिलती है. क्वेश्चन नंबर 35. इन्वर्टेड पैपिलोमा. ठीक है ना. ट्रू अबाउट इन्वर्टेड पैपिलोमा. पैपिलोमा. ट्रू अबाउट इन्वर्टेड पैपिलोमा. ऑप्शन 1, कॉमन इन चिल्ड्रेन. मोस्ट कॉमन इन चिल्ड्रेन. ऑप्शन 2, arise from lateral wall. Arise from lateral wall. Arise from lateral wall. Option 3, always benign. Always benign. Option 4, can be pre-malignant. Can be pre-malignant. या option 5, causes obstruction. Causes obstruction. Causes obstruction. फिर से देखिए. True about inverted papilloma. Most common in children. Arise from lateral wall. Always benign. Can be pre-malignant and causes obstruction. And the right answer is B, D and E. B, D and E. It is arise from lateral wall. Can be pre-malignant and causes obstruction. Inverted papilloma arise from lateral wall. It is pre-malignant and causes obstruction. Question number 36 देखेंगे. Question 36. Select correct statement about CL larynx. तो true about laryngeal cancer. True about laryngeal cancer. Option 1, glottic cancer is most common. Most common is glottic cancer. Option 2, supraglottic cancer is best prognosis. Supraglottic cancer has best prognosis. Option 3, lymphatic spread is the most common in subglottic cancer. Subglottic cancer most commonly spread by lymphatics. Option 4, T1 tumor is best treated by radiotherapy. T1 स्टेज के लिए रेडियोथेरेपी चलाएंगे. ऑप्शन 5, स्मोकिंग इज अ रिस्क फैक्टर. स्मोकिंग इज ए रिस्क फैक्टर. इसी के ट्रू अबाउट लैरिंजियल कैंसर. Most common is glottic cancer. Supraglottic cancer has best prognosis. Subglottic cancer is most commonly spread by lymphatics. T1 ट्रैप में radiotherapy चलेंगे. Smoking is the risk factor. And the right answer is A, D and E. Right answer is A, D and E. That is, glottic cancer is most common. T1 we do radiotherapy and smoking is a risk factor. Laryngeal carcinoma के लिए most common is glottic cancer. T1 में radiotherapy करेंगे और smoking is a risk factor. Question number 37. Question 37 regarding laryngomalacia. तो वो रहे कि true about laryngomalacia. True about laryngomalacia. Option 1. Most common cause of stridor in newborn. It is most common cause of stridor in newborn. Option 2. Omega shaped epiglottis. Omega shaped epiglottis. Option 3. Inspiratory stridor. There is inspiratory stridor. Option 4. Requires immediate surgery. Require immediate surgery. Option 5. Stridor worsen on lying in prone position. Stridor increase in prone position. फिर से देखेंगे. True about laryngomalacia. Most common cause of stridor in newborn. Omega shaped epiglottis is present. Inspiratory stridor is seen. Require immediate surgery and stridor increase in prone position. And the right answer is A, B and C. A, B and C. That is, most common cause of stridor in newborn, omega shaped epiglottis and inspiratory stridor is seen. Most common cause of stridor in newborn, omega shaped epiglottis is seen and inspiratory stridor is seen. Question number 38. True about quinsy is. True about quinsy. Option 1. Penicillin is used in treatment. Treatment is penicillin. Option 2. Abscess is located in capsule. Abscess in capsule. Abscess in capsule. Option 3. Commonly occur bilaterally. It is bilateral. Most commonly bilateral. Most commonly. Option 4. Immediate tonsillectomy should be done. Immediate tonsillectomy is done. Option 5. Patient presented toxic features and drooling. Toxic features with drooling. Toxic features with drooling. फिर से देखिए. True about quinsy. Treatment is penicillin. Abscess present in capsule. Abscess present लिख देता हूँ. Abscess present in capsule. Bilateral most commonly. Immediate tonsillectomy is done. And toxic features with drooling is present. And the right answer is A and E. Right answer is A and E. ठीक है. तो क्विंसी में ट्रीटमेंट इज पेनिसिलिन एंड टॉक्सिक फीचर्स विद ड्रूलिंग इज प्रेजेंट. क्विंसी ट्रीटमेंट इज पेनिसिलिन एंड टॉक्सिक फीचर्स विद ड्रूलिंग इज प्रेजेंट. थैंक यू.